Hey there! So, you're thinking about specializing in emergency medicine pharmacy? Well, you've come to the right place. We're about to walk through what makes the CHRISTUS PGY2 residency a really unique path to becoming a top-tier clinician. Let's get right into it.
You know, this quote really gets to the heart of what we do. Think about that for a second. The emergency department is where everything boils over. Every single second counts. It's the ultimate test, right? High stakes, high pressure, but honestly, it is so incredibly rewarding.
Which brings us to the big question, right? In a field that is literally defined by chaos, how in the world do you build mastery? I mean, really, how do you develop that unshakable expertise when every day is completely unpredictable? Well, the answer isn't just about cramming in a bunch of facts. It's all about how you're trained to think and act, right in the middle of that storm.
So let's talk about how we tackle that. Here's our approach, providing a structure for success, to move from chaos to clarity. Our whole philosophy is built on a really simple idea. To master chaos, you first need a rock-solid foundation of clarity. We give you that structure so you can focus on the important stuff. And here's what that means for you. Our mission is to let you focus entirely on learning and mastering the content. That's it. Your job isn't to create your own schedule or hunt down readings or spend hours just trying to figure out what you're supposed to do next. Nope, we've already built that entire framework for you. We're talking a full-on interactive calendar with every rotation, every assignment, every single task already mapped out.
All right, so let's see what that actually looks like in practice. Here's your week, all mapped out.
Okay, check this out. We use a predictable 2-week block structure. What's cool about this is you're not just stuck in one rotation for a whole month. Instead, you're constantly cycling through different experiences. You'll have days dedicated to your core EM skills, both critical care and acute care, but you'll also have built-in time for didactics and projects. We even mix in rotations in pharmacy operations and offsite EDs. This variety is key. It keeps things fresh, keeps you engaged, and honestly, it really mirrors the actual workflow of an EM pharmacist.
But you know, a great schedule is only half the battle. The other half, and this is a big one, is how you learn the material. That's why we've completely redesigned our approach to learning, specifically for you.
Okay, this is so important. We've built our learning formats for how people actually learn today. The biggest thing? We provide all the core content you need, everything defined by ASHP. You don't have to go digging for it. We give it to you in whatever format works best for you. You got your assigned readings? Sure, but also recorded lectures you can watch anytime. We've even adapted content into a podcast format so you can learn on your commute. And on top of that, we have videos with BCMP practice questions to really test your knowledge. Then you take all that and dive into real-time discussions with your preceptors to put it all into practice.
And this whole thing is guided by our educational action plan. It's pretty simple, really. First, we instruct. That's us giving you all that core content. Then we model. We show you exactly how to perform those clinical actions in the real world. Next, we coach you, giving you tons of comprehensive feedback to help you get better. And finally, we facilitate, which is all about driving that continuous improvement every single day. It's a full circle of learning and growing.
So how do you keep track of all this? That's where the EM topic log comes in. Think of it as your personal roadmap through the entire curriculum. It guides you through all the heavy-hitting areas. We're talking toxicology, cardiovascular care, resuscitation, you name it. It's a really rigorous curriculum, and this log helps make sure you're mastering it all, tracking everything from your discussions to your direct patient care.
So, where does all of this lead? What's the end game? Well, it's about going from being a resident to becoming a true leader. The goal here isn't just to make you a competent pharmacist. It's to transform you into a clinical expert and a leader in the ED. By the time you graduate, you will have mastered these 6 key objectives. And yeah, it all starts with amazing direct patient care, but it goes so much further. You'll be advancing the practice itself, building real leadership and management skills, learning how to teach and educate, and becoming an absolute expert in handling medical and toxicology emergencies. It's the whole package.
We like to use a pretty powerful metaphor to describe this role. Think of it like a football team. The physician might be the quarterback calling the play, but the pharmacist is the offensive line. You're the one providing protection, anticipating every move, understanding every single detail to make sure your patient is safe and gets the best possible outcome. That is who you are training to become.
And, no surprise here, your path to graduation is just as clear and structured as everything else. We lay it all out for you.
There are no secrets, no hidden hoops to jump through. You'll know exactly what you need to do to resolve any needs improvement ratings, hit your goals, complete your commitments, and document your cases. It's a totally defined and, most importantly, achievable path to success.
So, if all of this sounds good, if this structured, super focused approach to mastering emergency medicine feels like the right fit for you, then let's talk about your next step.
And yeah, we've even thought about the start date. We begin the first week of August, and we do that on purpose. It gives you some much-needed breathing room after you finish PGY1 to relocate, get your Texas licensure sorted out, and just settle in. That way you can hit the ground running on day one feeling ready and not completely rushed.
So, are you ready to bring some clarity to that chaos? If you're ready to connect, here's all the info you need. The program ID is right there. And seriously, please reach out if you have any questions at all. We'd love to hear from you.
So, there you have it. The structure, the learning, the whole philosophy. We've laid it all out. Now there's really only one question left. Are you ready to become the offensive line?